And we are live. I should get up and dance. And we are live on this beautiful Monday. Happy Monday to you and yours. And welcome to the feature for Pop and Chats. We call this Clinical Monday. This is our favorite feature that comes to you every Monday with a guest clinician. And this is where we'll be dissecting some certain topics, health topics rather. And today it is no exception. We're doing absolutely just that. You know that it is your way to begin a healthy week. And my name is Vigan Kosi. Please share your comments on the comment section below and share this live with your friends to tell them that we are sitting down with our favorite clinician and we are talking STIs, diagnosis, the treatment and care. And sitting on the chair of clinician or as a guest this morning, it is Sister Mapaseka Mapena from Oron Pop in Tembisa, the very same center that we're coming live to you on. And let me just give you a bit of a bio of who she is. She's a clinical nurse practitioner, a nurse educator and a nurse manager, NIMART trained certified clinician nurse mentor with 8 years experience and or experience working within the public health, and is passionate about HIV and TB management and to ensure that the 995 goal is reached. If you have any questions for her, please make sure that you use the question or rather the comment section below and share the live. Also on other social media platforms, you can hashtag Clinical Monday on Twitter. It is at @n_health. Tag myself, it is at Vigangosi, and also on www.popin.org, and make sure that you are participating in the conversation. And I mean, we started off the week on a very sad note with the late or the passing of the late Dr. Cindy Van Zyl. Those condolences are still going on. Don't forget to hashtag RIP Cindy and tell us how she has impacted your life. But today, right now, we are focusing on STIs, their diagnosis and the treatment. Have we had an STI? How did you treat it? You know, what are your experiences with them? Well, we are here to just have this conversation to help you maneuver around STIs. And like I said, Sister Mapaseka is here. She's looking rather amazing. I feel underdressed because I'm in my head.
Wow, I'm on a hot seat, you know, being put on a red chair, like I'm on a hot seat.
You are on a hot seat and you look ready for it. How are you doing?
I'm good, thanks. And you?
I'm great. So thank you so much for giving us the time this morning to speak about STI. We know that it is it's not the first time that we're speaking about it, but I think we need to speak about it more so that a lot of people can get the necessary information that they deserve when it comes to STIs. The first question is, how do we define it? Because I think everybody thinks they have this general definition of what an STI is, but you know, clinically speaking, how do we define an STI?
Okay, first things first, I'd like to say thank you for having me again. We've had this topic before and I'm glad that we're constantly revisiting it because it's something that is there, especially with us initiating our clients on PrEP and, you know, and ARVs, all those things. So people are constantly engaging sexually. So STI, it's an acronym that stands for sexually transmitted infection. So it's those infections that you get through your sexual intercourse, and others it can be skin to skin. Yes.
I think yeah, well, we are constantly, you know, engaging in sexual intercourse, so I think it is quite important for us to know what then causes an STI, and also, well, we'll dive into it a bit to sort of like differentiate between an STI and an STD. But you know, first, what causes then an STI?
An STI mainly it is caused by different types of bacteria and viruses. For instance, you'll have your chlamydia, your human papilloma viruses, even HIV itself is also part of a group of STIs. So yes, those are the main causes, and also having unprotected sex is the main cause that the person might end up having those signs of STIs. And then also having multiple partners, because remember, you are constantly engaging with different people without using protection, then you're putting your life at risk of contracting your STIs.
Let's talk about the differences between an STI and an STD, because an STI, like you said, is sexually transmitted infection, and an STD, it sounds like it's a sexually transmitted disease. What is the difference, if any?
Okay, mainly there's not much of a difference. The only difference is that the other one is an infection. So most of the common disease infections, they start being an infection, and then later
Gradually
you
go.
have a disease.
Oh.
Yes. So as soon as you don't treat your infection at an early stage, then it progresses into being a disease.
So you can have an STI and think that it's just an STI, and then it can progress into being an STD.
Remember, others don't have symptoms.
Oh.
So a person might have an STI not knowing that that person has got an STI. So yes, sometimes you might stay left untreated. Meanwhile, maybe you are even spreading it.
Wow. Wow. Maybe we can also jump into what kind of symptoms we should look out for when we have an STI. But then it becomes difficult if then you don't see that you have it. So I think maybe someone should do a roundup, check to see if they don't have an STI. Let's talk about the symptoms. Let's talk about first the common symptoms of common STIs, and talk about maybe some STIs that don't really show symptoms at the first stage of them.
Okay.
Yeah.
Currently, we are using a syndromic approach of treating STIs, right? Because as I have mentioned earlier, that we've got different bacteria and viruses that causes these STIs. So we have a different group. Number one, we have what we call a male urethra syndrome, which is most commonly found in males.
Okay.
So the symptoms, a person might experience pain when urinating, which we call dysuria in a medical term. So you have pain when urinating, or you might have that discharge that is coming out of the penis, right? Yes. And then we also have what you call genital ulcer syndrome, whereby a person has got ulcers in the genital area. We also have genital warts, where you have those lumps that not painless, they're painless. You can just carry on living, just seeing them as just a bump, you know. Yes. There are so many. We also have scrotum swelling, you know, whereby a person has got a swollen scrotum and it's painful. We've got bubo, we've got balanitis, where a person, those who are not circumcised, remember it is very, very important to circumcise. So yes, whereby you have difficulty in retracting your foreskin, you know. Yes.
So how, then it is important, well, I guess circumcision then plays a role in decreasing the chances of one getting an STI. I want us to touch on that a bit later. But let's then talk about you touched on the symptoms that are visible, that you can see and feel when you are infected, or when you have an STI. Then let's talk about some STIs that you get, I can get infected of, but I don't see the symptoms right away.
Yeah, the most common one is chlamydia. It may be asymptomatic.
Okay.
So you asymptomatic.
What does that mean?
It means you don't have symptoms.
Wow.
Remember, it's like your COVID. You remember I said
yes,
a person might be asymptomatic or symptomatic.
Yeah.
Right?
Asymptomatic, but still be a carrier.
Yes.
Okay.
Yes.
And you can still spread it.
Yes, that is why it is very important when we treat STIs. We don't treat only you. Remember, you might come with the symptoms and say, I have this and I have this. So it is very important that we also treat your partners or partner, right?
So it means I must then be able to provide information to say, I've slept with this person, and bring them forth so they can also get tested.
Definitely.
Circumcision, it's a plus in that it reduces the risk of getting STIs. But then does that mean if I'm circumcised, I cannot get STIs?
No, it only just minimizes the chances.
So you still can get an STI?
You still can get it.
It does not mean that when you circumcise that you cannot get an STI. No. You can still get an STI. If discovered, then what methods can be used to treat it? Let's say I'm experiencing one of the symptoms that you've said. Maybe I have a discharge, or I'm seeing sores on my genital. Then I come to you. Then it's discovered that I have a certain type of STI. Then what are the steps from there?
the steps is for you to come to the clinic or to the facility. With us, we also do it even on the outreach. You don't need to even go immediately. With all our clients, when we do HTS, we screen for STI. So it is very, very important for all the clients to be screened for STI as much as we are screening for TB. So we screen and ask you questions. When last did you have sex? How many partners? Did you use your condom? Do you know your status? Do you know your partner's status? How long have you had these symptoms and how is it affecting you? What have you taken to treat it so that we have a step further? Yes, and then we diagnose you and then we treat you and give you. We've got a range of antibiotics depending on what symptom you are presenting with. We've got broad spectrum antibiotics like your azithromycin, your ceftriaxone. So since I have mentioned before that we treat it syndromically, so us treating it syndromically, it is to make sure that we don't leave anything behind, right? Or you might be misdiagnosed and say you have this type of STI, whereas it's definitely not that one. So if we treat it syndromically, we are making sure that we don't miss anything. We make sure that V is treated. Yes.
Yep. Okay, and so I realize that I have an STI, or actually I don't realize that I have an STI because it's asymptomatic. I hope I'm saying that right. I'm not showing signs and symptoms, but I have it. Then it's untreated because I don't have it. I don't know if I have it. Then it's untreated. How long? I want to say two questions. First, how long does it then stay in my body, right? And secondly, can it then develop from being an STI to a disease? And then maybe at a disease stage, then that's when it starts showing symptoms.
Remember, each and every disease has got an incubation period. Okay. So even with your STIs.
Sorry, what does an incubation mean?
An incubation period is the time whereby now this infection or virus is developing. Like I want to make it simpler with your COVID. Remember, if they say to you, you were my COVID contact, right? You must go home for quarantine, right? When we say quarantine, is we are giving this virus a chance to show its symptoms, right? So that's what I mean when I say incubation. So even with an STI, I might sleep with you today and you have the symptoms and mine can show 7 days or 2 weeks later. Okay,
and if I don't know, then it progresses to be a disease. So and also, it's another interesting sort of aspect of it to say when now I have an STI, and it's a general perception that men, they don't want to go and get tested. We are afraid of abusistama baseka, I don't know why. And then now I'm told, you can, Habulanyana MBs are there, and then it can take care of the symptoms, or it can take care of the disease. Do you advise, I guess, men who come presenting symptoms of an STI to say continue on that Mbiza, or you're saying stop that a bit, take treatment, or like what is then the general navigation around that?
Yeah, because we are advocating for only medical, intervention. So yes, it sometimes it's difficult for other males. If a person comes in and say they find you there seated and they tell you, I've got this, I've got discharge, and then immediately when you say to that person, please undress for me so that I can see. First thing, it's uncomfortable,
it is.
But it's for you to be calm and reassure that person to say whatever we speak together remains here, confidentiality, And then we don't encourage people to use the traditional meds. Although we know we are African, we cannot just, totally,
discard that.
Yes, but we usually encourage people to say, please give a medical intervention a chance, and then you can go revisit, but at least for now, let us focus so that you can be able to see what is it that has assisted you.
Okay, if you just joined us, we are in conversation with Sister Mabaseka Mabena from Oram Pop in Etembisa, and we're talking all things STIs. And I'm learning a few things. I did not know that an STI can be I use that word. That one. And also, you know, that it can go on in the body for the longest time without you knowing that you have it. And I think it's quite important that when we go for our HIV testing, we answer those questions very honestly so that we know, is it there, is it not, and then we must get tested, because they are not testing just an STI, then they test holistically to deal with other things that are not showing. I have comments here, and I have comments to the floor. Oh, by the way, I have ghosts in my studios. Sister Mapaseka and I, we not only have this conversation by ourselves, we have other people in the facility with us to be part of the conversation. I see a hand, I've noted it, but I want to go to the comments online. We have Uspusiso Gosinati, I hope I'm saying that name right, says, is STI related to STD? Right, one. And then two, what are the differences between the two, as to say what differences from another? How do they then affect a person if not treated prior in time? I think you've answered this, but you can maybe try to elaborate further or answer him, because maybe he just tuned in. So how would you answer that?
Okay. An infection, it first becomes an infection, then progresses into being a disease, right? So if left untreated, it becomes your disease. It can cause severe damage. You can have even your, the male cancer.
Testicular cancer? No. Prostate cancer.
Prostate, yes. If left untreated, it affects other organs. You understand? Yes. For example, your hepatitis B. Your hepatitis B, if left untreated, then it causes. That is why most of the time it's asymptomatic also, right? But as soon as you left it untreated, then you start seeing those signs of jaundice, your yellowish, discoloration, your mucous membrane changing yellowish, your abdomen starting to distend, then you see that now there is a damage, and going back becomes difficult. So I would advise viewers, please go get treated early whilst it's still in the infection stage, because
then it becomes easier for you guys to treat it. Another question says, let's see, X-Men Muelas, it says STIs and STDs, same thing. Okay, not treated, it is obvious, puts you and your partner at risk of contracting the infection, and may also lead to many other complications. I think you just said all those complications. You can get prostate cancer. He says that certainly cancer, HPV associated cervical and rectal cancers, pregnancy complication, and so on and so on. I think X-Men, should I say a clinician of some sort? I think he just gave what you were saying there a bit of weight as well, because he's touching on the same vein. Jacqueline Jack Spinar says, nicely articulated, Mapaseka. I agree, Jackie. Nicely articulated. Continues sending those comments and sharing some of your views when it comes to STIs, and tell us what has been your experience. Do you know anything about them? What is it that you want to be cleared on when it comes to the topic? Let's take the questions on the floor with my ghost. Let's start with the first ghost, Heavy.
Oh, so you say I'm a ghost, the next thing you say my name.
The ghost that has a name.
No, I actually wanted to ask in terms of the treatment. I agree, we know that sometimes you get people who would come to the clinic and take the treatment. But again, go back and take a scoop.
Yeah.
What are the consequences of maybe taking both? And again, maybe also not finishing
the treatment. Course. Yeah. And maybe leaving it and saying, but I have a scoop, so I can drink the scoop, and Yes. And I think you've touched on that to say it's important, because you're advocating for medical use and treatment, so that people can say stop nyana ka scoop and then finish the treatment. How would you elaborate on that?
Thank you very much, Ghost, for that. Remember, we have what you call antibiotic resistance. So it is very, very, very important that you adhere to the treatment that you've been issued and take it as prescribed, as instructed, and finish the course. Because remember, as soon as you interrupt, or maybe if you feel that maybe the symptoms have disappeared and then you stop taking the treatment, then when you come back again having those symptoms again, then chances of you being treated become slim, because now you'll be resistant to this treatment that I've given to you. You understand?
Yeah.
And then you come back and say, sister, but you gave me, but I still have. It's because last time you didn't finish that. But I'm glad now, because most of our treatment, it is that doses. Meaning when the client goes out of this office, they don't have any STI treatment in their hands, unless it's another one. The most common one is male urethritis syndrome, the one that with the discharge. So when they get here, we give them, you take your antibiotic orally, and then we inject you. Then you just leave without your treatment. Then there's no strain of taking antibiotics every day, because I know most people complain about taking treatment every day. So yeah.
And I think it's quite important you touch on breaking the treatment. It could be for whatever reason. Two things. One, you said it becomes difficult for one to be treated if then they have sort of not have adhered to the medication, right? Then is the process the same? Do you then treat them again using the same medication, or now we add a dose, or like what's that?
We change because remember, now we are resistant, because that is why we mostly encourage all our STI clients to come back in 7 days. If there is no improvement, then we have a secondary treatment. Remember, like HIV, we mustn't leave HIV out of this, because HIV is also our STI. So even with our HIV clients, if you don't take your ARVs correctly as instructed every day, as we always educate you, same time every day, then it becomes a problem. That is why you find that the person is not virally suppressed. Then we see it as a treatment failure, and then you have to change the regimen. So that is how it works with the STIs. You finish the course. If it fails, then we have a second line. But remember, the second stage are harsher than the first stage, so it's better to do it right the first time, right? Don't complicate your life, then you end up having to be hospitalized with something that can be cured and preventable at the primary level.
Yeah, let's talk about I'm glad that you touched on HIV. So for our HIV our clients that are living with HIV, so I don't know how true is it or how not that even when you are HIV positive, you can still get an STI. First, maybe clear us on that and say then, is it possible for one to be on HIV medication? These are ARVs, and also be on another type of treatment, maybe for TB or for STI, for the sake of the conversation. Yeah.
Okay, thank you very much, Fi. That is a very important question. Remember, we are very fortunate that at least with HIV you can test even if you are asymptomatic. Remember, we have people who are HIV positive but asymptomatic. So at least we can test for it, and then as soon as you find out that you have it, then you take the next step. So it is very important that we screen. That is why each and every client that participates in HTS, we screen them to ensure, because even if you're HIV positive, remember HIV affects your immune system, therefore you are prone to getting other diseases, because now your immunity is low. So all these diseases, they come, especially TB. That is why when initiating our ARVs, we ensure that we also prevent TB, because TB is more dangerous. I always encourage our clients to say, don't take TB lightly. So you can be co-infected. With HIV, you can be co-infected, and yes, you can take other medication, because each and every medication works on the different ways. So if I give you ARVs, they work on the virus, and then if I give you something for STI, then it concentrates on whatever bacteria or virus that you have.
Wow. All right. That is very eye-opening for me. Let's quickly look at the comments rather coming in from our live right here on the Oram Pop Ins Facebook page. Don't forget to share this live with your friends though, and well, you might help someone and they might learn a lot. Elliot Bwangani M says amazing work, Sister Basi. I think everybody just loves Sister Basi. We love her too. Denny Mabena, I hope I'm saying the name right, says Suguma Mgani Bagbo. Oh, was Suguma after our conversation, then she can get up. Yeah, I told you guys when I opened that she is dressed to the T. X-Men, Denny Mabena, you are late. You've missed out some parts of this important discussion. Yeah, well, if they've missed on it, fortunate enough, we are recording this for also our YouTube channel, so it will be packaged very nicely. Happy likes to tell me that I like saying it's packaged. It will be packaged very nicely though, for your viewing pleasure, as at your convenience. So Denny, don't worry, you can catch up on it. Petete Masha says, I'm proud of Mapaseka Mabena making Mr. White proud. Viva Dinodo Technical School product. All right, I think that's where you studied. Oh, okay, we see ya. Thank you very much for tuning in. Hey, Denny, no, X-Men, they're having a conversation of their own on our live. Imagine. But okay, X-Men also says, please elaborate on virally suppressed, right? What are the numbers, viral load, in bracket, where we say one is virally suppressed? Is this the same as the undetectable and uninfectious? I almost said undetectable and untransmittable, because that's another campaign that we have at Oram Pop. But first, Uti virally suppressed, Sister Basi, in numbers, in the viral load, that first, and then two, where we say one is virally suppressed, what is it the same as undetectable and infectious?
Okay, thank you very much, Mr. X. With the previous guideline, we used to say when the person has got less than 400 copies, that person is virally suppressed. But now with the latest guideline, we say less than 50 copies. A person must have less than 50 copies for us to say yes, they are suppressed, you cannot transmit. So it's less than 50 to lower than detectable. Lower than detectable meaning now it's at zero, now it's completely suppressed. The benefits of taking your treatment correctly.
Yeah.
So that's what it is, because now if you take your treatment in a correct way, then you are able to suppress this virus, and then you do not transmit it to another.
So when it's on that level, for us to get it undetectable, or for it to be virally suppressed, it can only get there by us adhering to the medication, right? And adhering to treatment and finishing the course. And well, with an STI, when you finish the course, what then needs to happen? Do I come back to Sister Vice and say I'm done? Do we have to have a secondary screening or another treatment or another testing to say now you are out of the woods, you are clear, you can stop the treatment, or you don't have to go back to take treatment because now you're fine? What's the process when I'm done with the course?
Right. With the ARVs, remember it's lifetime. That one, there's no completing the course. It's lifetime. You stop taking your ARVs, then you're affecting your immune system, then it goes down. But then with the STI, if you feel that the signs have disappeared, you are healed, then it's for you to continue a healthy lifestyle, mainly condomize. If you are not circumcised, you go for circumcision. That is very, very important. And yeah, that lifestyle also, and then you also check yourself. You feel that you are not feeling well, don't wait till it's late. You are welcome to come back again.
Can clinically speaking, can someone be allergic or react differently to medication when they have an STI? Let's say I just discovered that I have syphilis or hepatitis B, and I come to you guys, and then you treat me, and then I'm somewhat reacting differently to the medication.
Mm-hmm.
Is that possible first? And then if that's the case, then what happens?
Right, very important question. Whenever we treat during an assessment as a clinician, it is very, very important that you establish if your client is allergic to any medication. So, for instance, we have clients that are allergic to penicillin. That alerts you to stay away from penicillin containing drugs. Most of our antibiotics have got penicillin, but at least if your client has got penicillin allergy, you know that maybe you avoid your ceftriaxone, because we have ceftriaxone in our treatment, so we rather go for another type of antibiotic that does not have penicillin, because that is very dangerous. A client might collapse just in front of you having anaphylactic shock.
Wow. You guys are dealing with a lot. You guys are dealing with a lot. We have another question from our ghost who's not happy. Yeah.
All right. No, I actually want to ask in terms of like, Sister Patsy just spoke about
prescribed medication for UV. It is yours.
Yeah.
Remember the storage of that medication question, the expiry date. For let's say for a certain, let's say a chest infection, I must give you a 5 days dose treatment. So if Happy shares his medication, let's say Happy took his medication only for 3 days, and then you take it for the 2 doses that are left, it will affect you. As I have said, the antibiotic resistance. You know, so you are creating more problems than helping the other person, right? So it's better to go to the facility or to the nearest healthcare facility, get what is directly to you. Sharing of medication is definitely a no-no.
It's a no-no. Let's not share medication. Let's touch on PrEP a bit, Sister Betsy, before we wrap it up. PrEP and STIs. I want to be initiated on PrEP, but I have an STI. Do you guys then stop the initiation on PrEP and continue putting me on treatment for an STI, or do I then get a treatment for STI while I'm initiated on PrEP and then take the treatments? Well, because this one is prevention for me, prevention of HIV, and this one is treating me. Like, how do we then move in that way?
Remember, what's nice about Pop-In, we are offering a comprehensive healthcare service, so we cannot pay attention to the other and neglect the other. It's very important that we approach all of them. So you are here for PrEP, and then we find that you also have STI. Then we treat you for STI, then you also continue with your PrEP.
Yeah, just by the way, I just got my 3-month supply today. I'm so excited of PrEP. So it is quite important then to continue taking the STI medication still while taking your PrEP, so it doesn't really affect your PrEP intake in any way, but you have to finish that. So I think also another important, maybe you can emphasize on this, is that PrEP does not stop one from not getting an STI. So even if I'm on PrEP, I can still get an STI if I'm not using condoms, right? We are so fixated with the idea that I'm preventing myself from one STI, in this instance being HIV, but it is possible for me to get other sexually transmitted infections, right?
Definitely.
Yeah.
So PrEP is there to prevent you from getting HIV only.
Yeah.
So that is why we encourage our clients to say you must continue using a condom, because there are other STIs, but likely at least they are treatable. You know?
Well, I think that's it from me. You were insightful, because I've learned a lot, especially when it comes to STIs. I did not know, guys, that you can get an STI and still not to see the symptoms. That for me is still a shocker even now. But thank you so much. Any other words of say encouragement to someone who's viewing who might have an STI but not know, maybe also tell them a bit about Pop-In and some of the services that you guys provide and work together?
All right. Please come and pop in at Ekurhuleni. We have a service for you. It's a non-judgmental space. You are welcome. Feel free, express everything. Do not come in and leave with your problems. Come to us, let us discuss whatever problem you have so that we work together. We have a referral system. We can refer you to the psychologist if you feel that our level is not enough. So yes, we also provide, remember, STI is part of condoms. We distribute condoms and loops. educational pamphlets, so please pop in at any time. PrEP is there, ARVs are there. Yeah, no queue anyway, it's fast queue.
Yeah, there is no queue. There is no queue. Thank you so much for your time. Well, they said you must get up. I don't know if you'll be able to get up and show. Well, you'll get up at the end. At the end of it. Thank you so much for your time, and I hope that it has been quite insightful for you as it was for me and the other people that were tuning in. Don't forget to share the live and tell your friends that we were discussing STIs. It's going to be pre-recorded for both our YouTube channel and also on this particular platform, so you can catch up and watch it as at your convenience. Really no rush there. And if you want to engage us further, make sure that you do so by dropping us an inbox. We have a WhatsApp line as well. You can also book yourself an appointment using our Facebook. There's a button there that says book appointment, and you can come and see people like Sister Mapaseka, who will then give you a guide as to your sexual health. And make sure that you live here with your pill. You drop your problems, you give them your problem, then you live here with a pill, and you live here lighter. Well, we'll see you next week Friday. We'll see you Friday for It's a Wrap, and hopefully you'll be part of that conversation. Don't forget the hashtag Clinical Mondays on Instagram. It is @popin. On Twitter it is @n_health. Tag myself, it is @viankosi, and hashtag also RIP Cindy. And this Pamandla case is still going on. We are still waiting to hear the developments to that. We know that Pamandla lost his life due to hate crime because other people are just homophobic. It's quite sad. People are homophobic. Somebody will kill you for just being gay, and I'm asking myself why is that? But don't forget to continue the conversation. See, I want to wrap this up, but there are other comments that are coming in. Danny says very insightful. Thank you for the info. Thank you so much, Danny, for watching. BJ Rams is watching. Hi, BJ Rams. X-Men is also okay, saying thank you so much, Vigangosi, and Sister Mapaseka, for this insightful discussion. Keep the good work up. Thank you so much for watching. See, also continue watching. BJ Ram says, yes, Sister see, educate us. X-Men says address for pop in clinic, please. Beyond Mabena, you are great, Sister Pasi. Okay, so let's attend that one. The address for pop in. But we need to do this one because we are here. But for other pop insights, please visit www.popin.org. But we are here. Where is the address? Sister Pasi, do you know the address by heart?
Margaret Zuma,
that one.
It's a Winnie Mandela Clinic.
Yeah. I just know at Winnie Mandela Clinic, behind it, you find us. That's where we at. But for more engagements, Oran Pop In on Facebook and also on Twitter, it is @n_health. Thanks so much for watching and happy streaming. Thank you so much for your time. Yes.